It's finally nice outside, and a lot of us are getting out, being more active, whether we're biking or gardening or playing with the kids. You've got to be careful about your back when you're doing all that. And that's why I'm visiting Raleigh Orthopaedic to talk with Dr. Mark Michaels about being careful about your back. First of all, are there different kinds of back injuries that you see?
Yes, there are. Typically, when you have a back injury, it's normally a strain or stretch of the muscles in the lower back. And it sometimes can be from a sporting injury or a work-related injury, or sometimes it can just be from bending over awkwardly and picking something up.
Can you show us the proper way to lift?
A lot of times people would just bend over at the waist and that puts a lot of strain on the back. So you really need to bend down, either put one knee down or two knees down, and then keep it close to your body as you lift up and hold it there. And that way you're keeping the muscles tight, and you're also keeping it close so there's not as much strain on the back.
Carrying children can hurt the back too.
Oh yes, especially when you have a child. People sometimes will keep it at their hip or far out. You normally want to keep it close, especially up close on your shoulder, and that way it gives it more support. And you be careful, especially if you have things far out, because that'll put strain on the back too.
Gotcha. If you don't follow that advice, you do end up hurting yourself. How can it be treated?
The way to get this to get better is give it a few days rest. We don't like people staying in bed for a week or two, but then after a few days you can get up, start doing some core stretching, strengthening, range of motion exercises with some over-the-counter anti-inflammatories, and it can help with the pain. A lot of this you'd have to do on the floor, and then also trying to stretch out in the far reaching upper and down. They can work on even core plank muscles, and also on the front and back, crunches, other types of exercise. And that's where sometimes we even have therapy facilities that can help assist with exercises, make sure you do them properly.
And of course, come see you and all the other doctors at Raleigh Orthopaedic.
Correct. We normally like to have people come see us if these persist for more than a week or two, or if you start having more numbness, tingling, weakness, or pain in the legs, then we get concerned more for a pinched nerve or a herniated disc, which may need to be worked up more.
Gotcha. Great information. Thank you so much.
My pleasure.
You can learn a whole lot more when you check out the website, RaleighOrtho.com.